All right, so now we're going to move on to denture care. Denture care is something that usually students have a hard time kind of wrestling with because you usually don't have a whole lot of dentures laying around to practice with. And it's kind of high on the ick meter for a lot of people. But denture care really isn't a hard skill to do. It really is just cleaning teeth. You can clean teeth in a mouth. You do it for yourself all the time. This is just cleaning teeth outside of a mouth, same procedure. And then we clean the mouth the teeth came out of. Don't forget that part though. Because you're cleaning dentures, we can't ignore the mouth those dentures came out of, because dentures are held in with denture paste. It's sticky, stringy, gummy, right? That denture paste is going to hold food particles right up against the gums. Well, if we don't get that off of there, those food particles are going to decay and they can actually eat into the gums, and that's no good. So when you clean dentures, you can't ignore the fact that the patient's mouth has to be cleaned as well. So we're going to clean the mouth using the mouth care process. And if you remember the mouth care process that we learned last week, you're going to see that again with this. But instead of using a toothbrush, we're going to use something new. This is a soft, spongy type of toothbrush called a toothette. See how it's kind of spongy? Looks a little bit like a lollipop, but it's not. Doesn't taste like one either. But they're soft, spongy. Now, the reason we use this instead, you can use a toothbrush. There's nothing wrong with it, but a toothbrush has bristles. Remember that denture paste I said was gummy and stringy and sticky? Well, if you try to get that off with a brush, then that sticky stuff is going to get all wrapped up in the bristles of the brush, and it's not going to be very effective. And it's going to be really hard to clean out too. By using this is a solid surface. It's spongy, it's soft, but it's still a solid surface. So it allows you to kind of wipe the denture paste off of the gums without being abrasive, and it's much better at collecting denture paste from the inside of the mouth. And bonus, this can actually be thrown away, so you don't have to clean it out. If you're using a toothbrush and you've got all that denture paste all gummed up in the bristles and then you try to clean it, that's a nightmare. So it's always best to clean the mouth using a toothette rather than a toothbrush, okay? Now, when we're cleaning the dentures themselves, one thing that a lot of people don't know is that dentures come in a couple of different varieties. So let me open my denture cups up here. Now, when we think of dentures, usually we think of something like this. This is a full plate of dentures. Okay, so this is a top plate, has a palate here. Okay, the teeth part here, but this is a full plate. And this is what we usually, if we talk about dentures, this is usually what we talk about. Now, patients can have full plates of dentures. This means that we pulled all of the patient's teeth. They have no regular teeth, natural teeth in their mouth. We have replaced all of them. Now, dentures can be a top plate, or they can be a bottom plate, or they can be both. But this means that we have removed all the patient's natural teeth. Now, the problem is that we don't always remove all of the patient's natural teeth. If they still have teeth that are in good condition, there's no sense in removing teeth that are still good. So in those patients, we would only remove the teeth that needed to be removed. And then we would replace the ones that were removed with false teeth. So you would end up with something like this. This is a bottom plate. But if you notice right here, there are cutouts for the teeth that remain. So here, this is going to fit around the patient's natural teeth. This ring is going to hook onto a tooth that's already there. And then over here, you can see that we have replacement teeth for the teeth that were pulled. Okay, so this is a partial denture. So you have full plates that replace everything. You have partials that will only replace the teeth that were removed. And then you have bridges. Now, bridges are little pieces of dentures, and they would hook onto teeth around the opening. So it's only going to replace a section of the patient's natural teeth. So you have full plates that replace everything. You have partials that replace some, and then you have bridges that replace a few. So there's 3 different types of dentures, and you're going to treat them all the same. You're going to clean them all the same. When we're cleaning dentures, we usually use a special brush called a denture brush. It has a big side, looks like a toothbrush, so we would use that on the teeth part of the dentures. And then it has a narrow side. This side is used on the channel part of the dentures. So see how it's smaller, more narrow? It would fit right in the channel part of the dentures. See how that fits right in the channel? That's why we use the smaller end in the channel, the bigger end for the teeth. So denture brushes are going to be used just like regular toothbrushes. We wet them first, we put toothpaste on them, and we brush with the appropriate side based on the part of the denture we're brushing. Dentures always have to be stored in water, cool water, never hot. Heat can actually affect the integrity of the material the dentures are made out of. So never hot, just cool. But they have to be stored in cool, clean water. So when you're done cleaning the dentures, we're going to clean the cup out by rinsing it, dumping it, and then filling it up with cool, clean water to put the dentures back in. And then we'll put a lid on it, and we'll put it over on the patient's bedside table or over bed table, wherever the patient wants it within easy reach so they can put their dentures back in when they want to. CNAs do not put dentures in. CNAs do not take dentures out. The patient has to be able to do that on their own. If they can't, then they don't use dentures and we puree their food. But you as a CNA cannot put dentures in or take them out because you actually risk dislocating the lower jaw. It requires a significant amount of downward pressure on the jaw to pop a lower denture up, especially if it's being held in by paste. Well, if you're doing that yourself, you would never dislocate your jaw because you're not going to put enough downward pressure to dislocate your own jaw. But if you are in somebody else's mouth, if you have your fingers in somebody else's mouth, in order to use your fingertips to pop up on the back part of the dentures, your knuckles have to press down for leverage. So your knuckles press down so your fingertips can press up for leverage. And that downward pressure on your knuckles can actually dislocate that lower jaw. So CNAs don't do that. Patients have to be able to put them in or take them out on their own, okay? But patients that take them out, if they can't clean them, we will do that for them. That is something that CNAs can do. Now, there's two ways of cleaning dentures. Every denture care specialist, the people that make the dentures, will tell you do not brush dentures with a brush and toothpaste like you do natural teeth, because natural teeth are made out of bone, right? Our bones are constantly being reformed, and if we cause little micro cracks, it's okay. Your body will work on that, okay? It can correct that. But dentures are not living material. They're polymer plastic. So when you use toothpaste and a brush, toothpaste is abrasive. When you use toothpaste and a brush, it actually causes little tiny micro cracks to form in the dentures. And those micro cracks create a warm, dark, moist place for bacteria to thrive. We know bacteria is in the mouth. So we end up creating a situation where your dentures won't last as long if you're brushing them with toothpaste and a toothbrush. But some people will still, even though the denture care specialists say that's not the best way of doing it, some people will still want their dentures brushed with toothpaste. If the care plan calls for it, that's what we're going to do. But for the most part, most patients are just going to want you to put 2 fizzy tablets in the denture cup, and those fizzy tablets fizz and they get into all those little cracks and crevices and they clean the dentures really well. And then all you have to do is rinse them and put them in a cup of clean water after that. You may have to take a soft brush just to brush any big particles off, but the denture tablets do a really good job of cleaning dentures and they're non-abrasive. So we need to check our care plan to find out which method the patient needs. Is it going to be brushed with toothpaste and a brush, or are we going to use the fizzy tablets? Whatever the care plan calls for is what we're going to do. But no matter what we've done, when we put the dentures back in the cup of cool, clear water, and we put the lid back on the cup, that cup is wet. We've rinsed it out, we've dumped it out, the cup is wet. So we don't want to put a wet cup on a wooden surface or a laminate surface because it'll leave a ring. Housekeeping will yell at you if you start ruining their furniture. So what we're going to do is take a paper towel and put it underneath our cup, and it's going to act as a coaster. So when we're done with cleaning the dentures, we put them in the cup, cool, clean water, and then we're going to put a paper towel under before we put it on the table for the patient to use later. Now, when we're at the sink and we're going to clean the dentures at the sink, those dentures are going to get super slippery. We're brushing them with toothpaste. That's what our care plan is going to call for this skill. They're going to become slippery, and if they fall and they hit the bottom of the sink, they may break. And dentures are extremely expensive. Your patient doesn't have that kind of money to just throw away. So when we're washing dentures, the most important step is to protect those dentures. So we're going to put a washcloth in the bottom of the sink, and that provides a softer surface should the dentures fall. But if you can get that washcloth over the drain so that the water pools up inside the sink, that's even better, because when the dentures hit the surface of the water, that will slow the fall and they'll gradually sink to the bottom, and it's less likely to have dentures crack or break if you have water in the sink. Now, of course, we always have to have gloves on when we're handling dentures, so you'll see me do that throughout this skill. I'll take the denture cup over to the sink, but once I'm ready to start washing the dentures, you'll see me put my gloves on. And then once I'm done with taking care of the dentures, I'll come over and clean the patient's mouth out using that mouth care procedure that we learned last week. It's the exact same process. We're just going to use a toothette instead of a toothbrush. So let's take a look at the care plan for this particular skill. All right, so if we look at this, our care plan says a resident with dentures is sitting at an overbed table with their dentures in a denture cup. The resident's dentures need to be brushed with toothpaste, and the resident needs mouth care. The denture is stored in a denture cup after cleaning. The resident is not able to provide their own mouth or denture care. And like anything else, if the patient can clean their own dentures, they will clean their own dentures. We are not involved if the patient can do it themselves, but this patient can't, so we will help out there. Now, if you go to the bottom, you'll see this is a longer skill. It says somebody with your level of experience will take approximately 13 minutes to do this skill. This is going to be done on another live testing student, so that means that you may be a patient for this skill. But no, you don't have to go out and get dentures. Nobody's going to be putting dentures in your mouth, nothing like that. The person that's doing the skill will simply brush whatever is in your mouth. Teeth, gums, whatever it is. Because remember, your patients can also have natural teeth as well as dentures filling in the gaps. Now for this skill, if you remember mouth care, the patient was laying in bed and we had to put the head of the bed up. That was a huge graded checkpoint. Well, for this skill, the patient's going to be sitting in a chair at the side of the bed. So we don't actually have to lift the head of the bed or anything like that. The patient's already sitting. They've removed that complication from us for this skill. But I want to bring your attention back up here to supplies, because it says that we need 2 sets of gloves. So I'm going to stop this screen share for a second. The reason that we need 2 sets of gloves is because we're going to use 1 set to clean the dentures, but now that set is dirty. The patient doesn't want dirty gloves in their mouth. So we'll get a new set of gloves right before we start mouth care. So it's important that you understand that you're going to use 2 sets of gloves for this, 1 for the dentures and 1 for mouth care, because the patient does not want those dirty gloves in the mouth. A question I get asked a lot on this skill is, can I do the mouth care first and then the dentures? And the answer is yes, you can do this in either order. However you want to do this is fine. But if you do, it means that you have to clean the basin twice. Because if you're going to clean the dentures first, you only use that basin to store the denture brush. That's it. It's simply to hold the denture brush. So it doesn't have to be cleaned before you go over and do mouth care. There's nothing in it. But if you do mouth care first, now the patient has spit in it. Now you've got to clean it before you can use it for denture care. And then you have to clean it again before you can store it. So if you don't mind cleaning the basin twice, you can do mouth care first if you want. I find it quicker to do it the way I'm about to show you, but either way is fine. There's no graded checkpoint on that. So let me see here. Rita asks, what are the most common skills for the exam? There is no like one skill that is more common than others. In your skills book, page 17, these are the care plan sets. You will get one of these, just one set. But these are the 11 care plan sets. You will get one of these. But there's no, there's no skills that, are more common than others. They're all parceled out pretty equally. Another question was how many or what's the average number of patients a CNA is expected to take care of in a day? And that depends. It depends on what your patients need from you. You may only be able to take care of 5 total care patients if they all have to be turned every 2 hours. They have to be changed every 2 hours. They have to be bathed. They have to be fed. They have to be, their linens changed, partial bed. So if you've got, 5 total care patients that can't do anything on their own, that may be all you can handle. But, somebody else working on the same hallway may have 12 patients, even though you have 5. They may have 12 patients because their patients are able to get up on their own. They just need some help walking to the dining room. They can get dressed by themselves. They just need help with buttons. They can brush their own teeth. They just need somebody to squeeze the toothpaste out. So because everybody has a different level of ability and a different range of needs from us, there's no set amount. I can't tell you, well, CNAs in Florida only take care of 6 patients at a time, because if your 6 patients are all like I was in that bed just a few minutes ago, where I'm only there for vital signs checks and I do everything else on my own, well, your 6 patients are a whole lot easier to take care of than 6 patients that are total care. So it's not, because patients have a widely varying need of care from us, it's not based on an actual number. It's going to be based on what each patient needs, and then those patients are kind of divided up between the staff that we have.